So above the muscle maybe is an older way of doing breast implant, breast augmentation, or is it still practiced with some physicians across the country?
Well, I can't speak for all physicians. I know it's still done. 50% of the breast work I do is revisional work from elsewhere, and a large majority of those are put on top of the muscle, because you have also with that not looking as good, they have a much higher chance of getting hard, which we'll explain in a bit. Why are some surgeons still putting them on top of the muscle? Well, it's simpler, it's quicker, and it's pretty painless. And then we get into the whole topic about there are a lot of non-plastic surgeons doing cosmetic surgery. Is it safe? You'd have to ask them what the rate of contractures are. Because you want to, whenever you do any procedure, you want to minimize revision rates, you want to minimize capsular contracture rate, or minimize risks, and there are ways to do that. There are ways to do that. The reason why American medicine is of such high quality is essentially boils down to there's an organization called the American Board of Medical Specialties, abms.org, and they recognize about 24 boards, and there's only one board of plastic surgery, and they try to minimize overlap of responsibility for different parts of the body between boards. So there's only one board of pediatrics, there's only one board of neurosurgery, and they charge those individual boards with, for example, plastic surgery, to training, educating, examining, written and oral exams, to create the best and safest plastic surgeons that America can. And that's a long process. To become a plastic surgeon, before you even start plastic surgery, you have to have a full ENT residency, a full orthopedic residency, or 3 to 5 years of general surgery. Then you have another 3 or 4 years of plastic surgery with maybe fellowships. So it's a long haul, whereas there's a loophole, what I consider a loophole in the law. My father was the first family doctor in Cucamonga, and back then, when he went to medical school, there were no residencies. You only had a year of internship, and you went out and practiced medicine. So he did that. He went out and he learned from different mentors that had already been in practice there, and he learned in practice. And he had to be able to do anything possible because there was no one else there to do it. And that's why, because there are also very few residencies after, or just an internship afterwards. Back when, you can legally do anything you wanted to do after medical school. Your medical license gave you that. Nowadays, with things that have changed so much, and we have so much extra training, I can legally do your heart surgery, but you don't want me doing this.
Right. Thank you.
Yeah. And so nowadays, in my opinion, the law should change. So doctors can only practice in the specialty in which they chose to train. So because of that, and it's some leftover too. I mean, it's like, and it worked well in the past. There are some family doctors that didn't become, through practice, because there weren't any general surgeons, they became the general surgeons. They didn't go through residency, but it just was, and they grandfathered in. And things like that happen in cosmetic surgery too. But nowadays, it should be more controlled by this one organization. That's my opinion and perspective, to maximize the safety of patients.
And so
but I digress.
That's okay. A patient, though, then, that is going to go to a board-certified plastic surgeon, is the percentage chance of them having it placed under the muscle is much greater.
Yes, so the majority of board-certified plastic surgeons put them underneath the muscle.
Okay, because it's better, it's safer, it's more natural looking.
It's more natural, and you significantly decrease the biggest risk of breast augmentation, and that is getting hard, or what we call capsular contracture. It's significantly decreased when you put them underneath the muscle.